Welcome to Voices and Nursing with Dr. Nozil, Care, Policy, and Leadership. I'm your host, Dr. Yolaine Nozil. Today, we are addressing one of the most urgent challenges in healthcare, the nursing workforce crisis. From retention at the bedside to the growing shortage of nursing faculty. These issues shape access, quality, and the future of care. Together, we will explore leadership, innovation, policy, and solutions that can strengthen and sustain the nursing profession for generations to come. And I am pleased and honored to bring a guest speaker today. She is an entrepreneur, a nurse leader, and a nurse practitioner. We bring Mrs. Farah Joseph. Hello, Farah. Welcome.
Thank you, Dr. Yolaine. Thank you for having me here today.
Before we start our conversations on the nursing workforce crisis, I would like to get more details about Farah. Who is Farah Joseph and what is your path from nursing to leaders and to entrepreneurs?
Well, thank you so much. I'm happy to be here. I think it's a great podcast focusing on nursing, the nursing workforce, and so on. So, yeah, your question is who is Farah Joseph? As some people may know, my name is Farah Joseph. I am a nurse practitioner. First of all, I am a mother. So, in the nursing trajectory, let's say I started with a Bachelor of Science in Biology. Then I went into nursing as a registered nurse. I had my bachelor. And along the way, then, recently became a family nurse practitioner certified. And I've been a nurse for over 10 years. I've done bedside, clinic, primary care, urgent care, ambulatory care. Work wise, I started as a bed nurse in internal medicine, like mini ICU and ER mixed together. I loved it. I used to work night shift, the 12-hour shift nights and switch in days and nights. At that time, I was like, I need a daytime job. I need to be in clinic, no weekends.
Okay.
Because clinic, you can find clinic jobs where, as a nurse, you don't only focus on, oh, nurses overwork. Nurses only do 12 hours. No, there are clinics where you can work. And one specialty that I chose is oncology.
Yes.
My oncology, which is some people
A
may say
great
it's hard,
specialty. Yeah.
but it's a specialty. I transitioned from internal medicine. So I went there. I started as a liaison nurse. I did chemotherapy, IV, chemo treatment. Then I ended up doing stem cell transplant. I became a coordinator. I
Okay.
did stem cell transplant coordination for peds. So I loved it because you get to work with the whole family. It's not for everyone, as they say, but I think it's specialty. Some people say they love kids, some people say they love adults. And, I love working with from 0 to 100. But I found myself when I got there, I think it was a path for me as a nurse. The care team, I loved it. Working with the family, collaborating with other physicians, other specialty like social workers, psych, everything was included and it was a team. So I love that path. Then I transitioned again to bone marrow transplant coordination for
Wow.
adults. And then I got to see a whole other world, like, with working with adult taught me a lot. I came from the kids to adult, and then you realizing adult are dealing with so many hematology and oncology issues, especially, our race. Then you really got to work with, people my age, and then realizing that life is not as long as we think it is.
Yes.
So working as a nurse for me taught me not only to care about others, but to love my life, love myself. So I love being a nurse. And then that's why I became a family nurse practitioner so I can do more with the same population as from 0 to 100, getting to know my patients, be more caring, and do more like teaching, education, assessment, diagnostic. It's needed, as you may know.
So that's a variety of
Yes.
things. The entrepreneurship, where is it came from?
Weirdly enough, when I started my first bachelor degree in biology, I was always amazed by other business owners. I used to love real estate. I got a job, but at that time, I started paying. No, I love people. I wanted to be out there. And I almost transitioned to PR, public relations, at the last year in biology. I'm like, why did I just do that? Then it was too late. But I always found myself in places to deal with other business owners, starting a business. Most of the jobs that I've done were with startup businesses. Okay. I got to be part of the branding, marketing, sales. I've done all of those. I have over 10 years experience in customer service. So I love customer service. That taught me how to speak with people and respect people and patience. And then I transitioned into that side because you have to learn how to listen to people. So I just give what people need. And then I met my husband does IT and cybersecurity, and I saw it was something that was needed, a service that was needed. Then I said, you know what? Why don't we just focus on that, transition into that, and make it into something that we can serve the population? Because to me, when I saw IT and cybersecurity, it's serving the same purpose as nursing, as we are preventing issues from happening and we are giving safety, security to business owners. So that was a way for me. I'm like, okay, you gotta assess, evaluate what the person need, then write policies, find out about compliance and all those roll around. Like HIPAA. Exactly. And it's part of the business as well. So I found that I loved it and I'm just gonna continue into the same path. One of the things is being an entrepreneur or being a business owner, you own what you have, so you control how you service other people. A lot of things to me can be fixed by becoming your own entrepreneur,
Yes.
having your own business. So sometimes we see things happening a certain way. And to me, the best way to solve it is do better.
Got it.
That's why entrepreneurship is to me.
Thank you for sharing all of that
Of
with
course.
us, as you know. And then, from your perspective, what is driving the nursing workforce crisis today?
That's a great question because it is our reality. So, nursing workforce today, to me, it is the fact that, first of all, after COVID, let's just back a little bit, 2019, there was already a lot of staffing issue prior to that. And we know as nurses, staffing is a big issue. Taking care of patients is our responsibility, but it has to be done safely. So I think one of the reasons people are leaving for us is the fact that one, the staffing is not enough. Two, burnout is a real thing in nursing. And third, what I see is the time. If you have people working for you as nurses, first we are human. So if the work environment is not safe and it's not something that giving us growth in the long run, most of the time people are going to run away from it.
Yeah.
Although the pay is good, we're doing it because we love it, because you have to be passionate about what you do when you are a nurse. But I think some of the reason is really the staffing issue,
Yeah.
having a break and making it an environment where you are still growing as you are taking care of your patients.
Like I would say,
A mentorship.
having a mentorship
Yes.
program, do breaks, do giving breaks and stuff like that.
Yes.
And then I can tell you one of the experience that I have from the retreat. It's from Women of Hope. So this is one of the best retreat ever.
That's amazing.
Because with retreats, some organizations, when they invite you to come on a retreat, there it's just like you went and studied not the curriculum, just rules and regulations and what they want at work. But retreat was supposed to be about me, how I can get a break my mental health or do some counseling, have somebody to come in and speak with me about the stress that I'm having, how to relieve my stress. That's all I like about the retreat. And then I would think mentorship in a good retreat, the nursing workforce is lack of that also.
I think also the work-life balance.
Yes.
It's a great goal. I mean, even in business and in nursing, you need a good work-life balance. Don't strategize and know how to work or time management
Yeah.
with your
Yeah.
time as a nurse. Because we know when we get home, after we do those 4 days, even if we have 3 days off, we don't really relax. The first day is really like to recover. By the time you fully recover mentally and physically, you have to go back again. So it's like now you have to sacrifice, what do I do? What do I choose? My wellness, my self-care.
Open.
So I think there has to be a balance. And one of the things that hospitals or even anyone working with nurses or healthcare professionals is knowing when to give people a break and making the environment as a growth and mental wellness, awareness environment. Yes, retreat is a great way that we can offer to other people. There are a lot of other stuff that they can do. And, focusing on your staff.
Why the experienced nurses are leaving and what can make them stay?
There are senior nurses retiring. There are nurses quitting nursing because of everything we just said. And there's not enough nurses coming in. One other thing that is lacking is mentorship. As you said, what are we doing to stop them from leaving? If my license is on the line, why would I risk it? So those nurses, we need to figure out why. Personally, I think it's a safety issue. One, it's a burnout because there are other options. So people who to become nurses or being in the healthcare in general, we need to find a way how to make it better for them. Offering the first year mentorship once people graduate, what are we doing for them? Are we paying for those people in school for the clinicals? Because a lot of us are looking around for clinicals because if you don't go to a regular brick and mortar. So there have to be programs to me. One for retention.
But now, do you think it's AI coming in, all this discouraging the baby boomers from staying also? Is
AI cannot replace nurses. I
Mhm.
think AI is a tool. That's what it is. Because if you remember when EHR was coming, a lot of people didn't like it. But
It is
yes, it is
useful.
just was needed and it's still needed. So AI is something that the new generation already know what it is. So the seasoned nurses need to learn. Learning is part of our growth and our progress. So to me, AI will be solving issues and we just have to embrace it and put it part of our work.
And I know 12 hours in a hospital, it's a long time. Although it's long, I'd rather get 12 hours, work 3 days, and I know I'm done. But we do have nurses that work more than 3 days. When you have responsibility, you have things you have to be doing. But now I've seen more and more nurses trying to stay away from the bedside. Everybody wanted to be a nurse practitioner. They wanted to have the DNP, the PhD. People don't like to stay at the bedside because of the support, the lack of support, the hardship. That's what make them discouraged to leave. I would always encourage them to give them support, time off. You have 30 minutes. You can't go anywhere with that 30 minutes break. And then somebody's watching you. You cannot sit down in peace to eat. You have to really love your work to stay. And then some of the places, like in California, I heard you can get an hour break.
Okay, that would be good.
So that's why I think maybe something like that will help some nurses too. But they've been saying that. Are the organizations listening? How do work environment compensate?
Well,
I know most people for retention, they want compensation, they want
yeah.
money.
I know when I quit some jobs and they call and follow up and offer you new things. But I think it's supposed to stop it from the roots, not when people are already
Gone.
leave. To me, compensation is a work-life balance. If I have to choose between work-life balance and money, well, that includes money as well. I would
Okay.
choose my work-life balance. Because if I'm able to manage work, my life, I still continue living properly. And then at that time, I would not even think about quitting or going somewhere else. I can get time off when needed. One of the things, safety was a big issue to me. Second was really giving me enough time to breathe because I don't want to end up being sick afterwards and burn out. So it's really better work environment to me before it becomes a mold of stress.
So, how does the nursing faculty shortage threaten the future workforce? As the nurse faculty work in a university, how can this affect the workforce?
But for me, like education, as you know, is a pay cut, right? Not a lot of people want to take that pay cut. And when people are working in education, education takes a lot of planning.
Yes.
The planning, the follow up, the mentorship, the every single thing. As an educator, it's a hard job. And you have to be available because once you leave school, you don't just leave.
Mhm.
You have to continue grading, continue doing all those things, mentoring those kids, maybe wanting to quit.
So academically, it's hard. I'm going to tell you it's hard. One, they don't pay. I went in academia because I love it. For instance, I teach at the university, even though I know they don't pay, but I go anyway because I enjoy what I do. And it was just like a self gratification. I was supposed to take a student to clinical on Saturday. And on Tuesday, I get calls that my dad was in a hospital. So I went and called them and sent an email. That happened on Monday. On Saturday, I would not be able to take the student to the clinical for the practical. So my dad have a heart attack, so I have to travel to Florida. And then they told me, okay. So during that funeral, I've got a text. Where are you? I said, my dad is burying today. And then he says, well, are you coming next Saturday? No compassion, no empathy. I was so upset. And then the student went there. They didn't have anybody to with them that day. I don't know what they did, but I can tell you, I wasn't going after that. I didn't go, and they don't care about the shortage of nursing. But I was caring. I really regret that for the student. I really feel bad for the student. But some institutions, they just care about the number of students that they have. The quality of education that they're going to have is the how many students they can have coming in, and they want a body to be there with them. My dad died, and I was like very close with my dad. And then just in the funeral to receive a text like that, I told you today's my dad's funeral. Oh, are you able to come in next Saturday? I said no. And that was the end of me myself in that institution. That's another. They were already shortage because I remember when I was doing my doctoral, my topic was descriptive phenomenology on the lived experience of nursing faculty and academia in Georgia. And my result, they found in the study a lot of participants things that they don't like about those institutions. They don't care about you as a human being. You're just a number who's teaching. And then they don't acknowledge you don't have any mentor or anything like that. So if you love teaching, you want it to be in academia, you on it because you love it. So it was an experience that I've learned. That's why I bring questions to ask you and then to see what you take on it.
I think that's one of the reasons. I think any business or even as an educator, right? So the empathy,
No.
compassion, and understanding when an institution or managers are responsible for those things, you have to screen for empathy. You
Yeah.
have to screen if that person can really hold that position. Because as you know, we're not numbers. We're not just like, okay, you being replaced. Yes, people are replaceable, you can say that. But a well educated and someone passionate about their job or what they there's no
Yeah.
price tag. So you need to learn how to be compassionate and to understand when people are going through a crisis. First of all, acknowledge, being sorry about what happened. Second of all, okay, do you need time for grievance?
So, what barriers prevent nurses from transitioning into academia?
Barriers. Again, let's go back to the paper. Everything is just said. With all the planning, with all this, it's a lot of work. And again, you have to be passionate about what you do.
Yeah.
So transferring to academia, because when you're educating, it's your whole life, and that's what you do.
Yeah.
You have to show up every day and do your best.
Yeah.
I think that's one of the reasons. You have to be passionate about what you do. You have to expect that they treat you well. When you
Yes.
come,
Yeah.
you studied for it and you want to transfer your knowledge to other students. So it's a whole preparation.
And I love to share my knowledge. I love to share and I love teaching. But don't treat me like I'm a number.
It's the
I
environment, it's
don't.
the work
Mm-mm.
environment. Like any business or any job that you take, the work environment is number one. How you treat your employees, it's all that.
How can nurse entrepreneurship help address workforce and retention gap?
I think they can do a lot. Nurse entrepreneurship, first there's teaching, the academic falls into it. Nurse entrepreneurship, you become your own boss. You are the owner. So if, let's say for yourself, for example, you had a bad treatment and you had a bad experience. So when you become an entrepreneur, you don't want to give the same thing. So you already starting from experience and you want to offer something better. So I believe a lot of nurses who became maybe nurse practitioners or we want to become an entrepreneur or even registered nurse, that transfer of knowledge mixed with some mentorship, opening clinicals for other nurses, showing the other side. To me, that's an incentive for people to go back to school, to stay in nursing school, because there's a future. People's gonna choose where to go. Some people love doing 12 hours because they can manage their time that way. So having nurse entrepreneurs showing the other side and how it's done, to me, that's solving, like, small business drive the economy anyway. The bigger organizations are great, but small business owners, they are solving an issue, they are serving. To me, that's the future. Yeah, and that is why I've opened the GA healthcare training and consulting, yes, where I can consult a facility, do staff training, and then do training for personal care home, and then teach them how to do really quality care and how to express compassion, how to treat people as a human being, not as a number. We need to be treating with compassion. We treat patients with compassion. We want to be treated with compassion also. As a nurse leader, as a nurse entrepreneur, we are not a number. So we have bloods also. We choose to work hard. We choose to do this, and I could go to California and work for bigger money. But that's it, because small business owners or nurse entrepreneur, you are serving and solving at the same time. Yeah. Because you experience it sitting on the table. Not only that, let's go to policy makers. Check. Let's change it from the top. Let's go to the roots. People who can make change, voting, everything else is, yeah, included. So when you are an experienced nurse and you are an entrepreneur, yeah, so you are well versed to teach and to, yes, show like how it should be done. And we're gonna have the nurse retention. Yes, yes. Let's drive the force like that. Me, that's the number one as a nurse practitioner. Is just to be independent and being well versed, as having a mentor when you come out of school to educate, having opportunities or different paths where you can connect with other people who's been through the trajectory, can teach you and guide you. I think that's well needed. If you decide to go to an organization, have incentive. To me, again, it's just having those opportunities for new nurses and seasoned nurses or people transitioning. Let's start from the roots, the policy, let's change it to make it. And then better. What again with the new administration who doesn't even know what they're talking about? Dequalify nursing as a profession. Yeah. Again, so that's why it matters who you vote for or who's talking for you. As we know, most people making decisions don't know your reality. Yes. And you have to really understand what we are going through and understand all those things before you make a decision. Yeah. If I'm sitting on top and I'm making this, I'm gonna make what's best for the organization, not thinking about the staff. Yeah. So when you do that, what are the consequences? I'm not too versed about politics, but I know it's needed. It's necessary to make changes. I think we need to. I know nursing. We huge enough. We big enough to have a voice together. All nurses to bend those type, yes, of conversations that they're having at the White House, or to denounce it, because we are professional. If we put together and say we're not going to accept it, we're not going to take it. We are professional. We work hard for that. We treat, yeah, people, and then over 10 years. Yeah, and then besides a nurse is on every profession. Even at Publix, you will find a nurse. They will find a nurse, and then at the airport, every places, school have a nurse who treats and care. Everywhere. We are the backbones of the population. This profession, it's a backbone of everyone. It doesn't matter. As nurses, professions that, like, disease doesn't go on trees. It's the same thing as everybody gets sick at some point. Yeah. And who's gonna taking care of you as a nurse? If you're trying to block nurses from getting the degree to become a nurse, we already have a shortage, right, at the bedside. And then you're trying to demonize or degrading nurses, not the profession. You want to kill the population? What? Come on, you, well, people. I think one of the ways also, because we all have a voice, as you just said, and I think I know I've learned policy in school when
Yeah.
before graduating. They did have us see
Yeah.
changes and all those things that I had to study. But the only thing is, it's just knowing where to go. So this is something that needs to be done from school. Knowing you
Right.
have a voice, which organization are you joining? All those organizations doing what needs to be done. I work with law firms and all those things. They all have an organization where, automatically you register and
Yeah.
it's showing up,
Mhm.
talk as you are doing the podcast right now. You have a voice. Not only that, join the people making changes, join
Yeah.
those leaders because we need them. The nursing
So I'm a
association, there's a
member.
lot of them.
I'm on the legislations court, and I'm going to Washington to November. What is it? February? In February, February 4th.
That's good. So when you get back, the best way is to announce it
Yeah.
and knowing where we need to be.
Yes.
So it needs to start from when people are graduating to other business owners.
And March 11th, we're going to be at the Capitol in Georgia. All right. So, how can nurses can influence workforce policy
Without holding a formal title? Let me think about this one. How can we do that? So again, I think it goes back to policy.
from the
That's where
bedside? I
from
would say from the
bedside.
bedside.
Well, from bedside, we are already advocating for the patient.
Yes.
So we need people
Well,
advocating for us.
we know we have to advocate. Is every nurse's advocate for the patients?
Not necessarily,
But
we need to. I mean, it's
we
part
just
of
have to bring
our.
awareness of
Yes.
that. So that's what this podcast is
But
there
the
to
problem is, why are they not advocating?
politics.
And again,
Is it hospital politics?
maybe I don't know. But so that's why we need to get to the roots of the problem.
If in your facility they don't have a unit practice council, you can form one. The unit practice council is the things that happen in the hospital. It can be from the nursing workforce to patient care. If there is something that is not right, you bring it and then you bring it to the nurse practice control console, and then policy can start there. If you can make some changes at the hospital, you can join different organizations to make changes. And then I know with Georgia nurse associations, they have this legislation committee, and we do have people that can lobbying at the Capitol and to start making changes and things that not working well. And I know they've been doing a pretty good job. It's just like for I would say for our colleagues to get involved. Although I don't do bedside anymore, I still engage and get involved to make sure that there's some changes made.
We get a lot about nursing, what we need to do, and all those things. So I think the other thing would be what is available to us.
Yes.
So part of it, there's networking, there's organizations within the organization that you can go to that we are not aware of. It's
Mhm.
left to us to discover it. So
Yeah.
I think part of it should be training people or letting them know what is available to you for that reason. Because it's like those fine prints that you
Yeah,
don't even
yeah.
see
Mhm.
unless you're aware or unless you are looking for it,
Yeah.
right? You have to. But if
Research
it
it.
was available on the internet or while you were training, oh, here's what's available, here's this and that, people will be more involved.
What gives you hope about the future of nursing and what must change now?
I think what gives me hope is listening to other people wanting to make changes. It starts from that.
Yeah.
So there are a lot of people, we're not part of the problem, we're part of the solution, right?
Right.
So we have our own experience, and now let's bring it to the table and see how we can make it better for the next generation or for us now.
Right.
So the fact that you have this podcast bringing out our voices, you talking for us based on your experience, you speak for the majority of us. So that gives me hope. And maybe it's going to reach a couple of people, or we can make it get somewhere. Policymaker, policy changers, the leaders, organization, and all those things, they can reach them so we can make it better for our nurses. Because
Right.
nurses is needed. It's the backbone for everything.
Yes.
We collaborate with everybody. You are in education, you do entrepreneurship, you're part of the legislation team. And as myself, I'm a nurse practitioner. I can train other people. We need more of us, and we need to find those people, maybe through this podcast. If you are one of those people, let's make that change together. Reach out to Dr. Nozil, find out how we can collaborate. What can we do to share? Or reach out to those organizations. Sometimes it's just a call, or you can just say, I want to participate, I want to get more involved, or I'm a new grad. How do I do this? Who do I reach out to? We are here for you. So being someone like you, it's not all of us, we're gonna admit it, but leaders making the difference matters. It matters for our voice, nursing voice, and it matters for our future. So that gives me hope. Or the change maker.
Thank you.
I'm
Thank
so
you.
proud of you.
Oh,
So
thank you very much. It was a pleasure to have you here today. If you're watching this show, you like it, please comment and let me know what you like about it. What do I need to improve? Since this is a new podcast, what kind of show would you like to see and what topic you would like me to bring? If you are a leader, a policy maker, a nurse practitioner, or nurse leader, anybody on healthcare arena, you are welcome to come to the show and share your stories. If you are a patient or a family member, please email me at Yolaine, YOLAINE NOZILE or you can email me on YNOZILE at gahealthcaretraining.com so you can be part of my guests. You are welcome. I thank you for watching and please share, subscribe, and likes.
thank you.
Do you have a voice, a story, or expertise that healthcare needs to hear? Voices in Nursing with Dr. Nozil is a professional podcast elevating conversations at the intersection of care, leadership, and health policy. We're inviting chief nursing officers and nurse executives, bedside nurses, and advanced practice registered nurses, nurse educators, and academic leaders, hospital and healthcare system leaders, patients and patient advocates, family members and caregivers, policy leaders, elected officials, and community advocates. If you have expertise, lived experience, or insight that can educate and inspire, there is a seat for you at this table. To become a guest, email Dr. Nozil at ynozil@gahealthcaretraining.com. We look forward to amplifying your voice.